So next I'm going to focus on Gen 2 tips. Did you know that Gen 2 will flag if a patient's pregnancy management fee is due? When an appointment is selected, it will flag at the top that the PMF is due. In Gen 2, you can also run a pending births report to see all patients who have a pregnancy due in a certain month. To view this, we click the three dots at the top right and choose pending births. We find our month that we wish to look at, and here we can see that there is a patient who is due to give birth in that particular month. There's also some further information available to view in this window. So as a practice, if you ever want to know who are the patients that are due to give birth in a certain month, you can use a pending births report to find these patients. In Gen 2, there's the ability to add your own fields to the consult notes window. To do this, we click the Add menu, Consult Note. You will see that the standard fields appear in this window, including the reason for encounter, history, examination, and planned. If you want to add your own fields, we click the cogwheel button at the top right. I'm going to tick diagnosis in this instance. And what this will do when I tick diagnosis, it'll add a box that says diagnosis. I can also click and drag to change the order should I need or want to. If I want to add my own field, I click plus text field and I give this a label. I hit the tick, and this will add a new box called medication history, and just the same, I can reorder my boxes if I want to. In any of these boxes, you can also click the drag handle at the bottom right, and what this will do, this will change the size for you. Next thing I want to do, I want to show you something that is often missed in this consultation window. It's called the reason for encounter. This is the reason why the patient came in to see you. It's a consultation heading. So for instance, I can choose something from the list, and that will come up in the list. But what happens if you want to add your own reasons for encounter? This is in the settings window. In the settings, there's reason for encounter, and this is your master list of different reasons that you can add to the reasons for encounter list. So I strongly recommend using reason for encounter. It means that you're easily able to see your consultations. So a nice use case is a new patient. You could add new patient as a reason for encounter, follow-up as a reason for encounter, post-op as a reason for encounter, and you can easily then find which consult you wish to look at. You can take a photo in Gen 2 using your mobile phone. The advantage of this is the photo does not belong on your phone and it gets directly uploaded into Gen 2. To do this, we open the web browser and we log into Gen 2. We go to the appointment diary next. We choose the patient we wish to take a photo of. We then click Add, then Attachment. We click Choose File. Then we choose Take Photo or Video. This opens the camera and we choose what we wish to take a photo of. We click Use Photo. We can then put in what the name of the file is. We can then also choose a category, which is which tab of the clinical file do we wish to this document to appear in. So for instance, if this was a procedure photo, you could choose procedure, then upload. The nice thing is now this procedure photo will appear alongside your typed procedure notes.